Really pleased to be presenting to you today. We have an exciting piece of work that we're interested in sharing with you and hearing some initial feedback from you on. Topic for the webinar is creating engagement capable environments in OHT a framework for action. This is work that's happened over the last number of months, and I'll just start by introducing myself quickly. I'm Julia Abelson from the Public and Patient Engagement Collaborative at McMaster University. We are one of the OHT implementation support partners, working on building block 3 in particular, patient family caregiver partnership and community engagement. Also wanted to briefly introduce our 3 OHT co-presenters, Lindsay Wingham-Smith from Mississauga OHT, Latcha Hives from Nipissing Wellness OHT, and Reham Abdel Halim from Burlington OHT. You'll be hearing from them a little bit later in the presentation. They're going to give you some perspectives and reflections on this work from their vantage points in OHTs. But before we actually kind of kick off the content of the webinar, I wanted to just take a brief moment to acknowledge the traditional territories we're gathering on. In my case, I'm here at McMaster University, which is located on the territories of the Mississauga and Haudenosaunee people within the lands protected by the Dish with One Spoon Wampum Agreement. We honor all First Nations, Inuit, and Métis peoples, their valuable past and current contributions to the land, and really recognize our responsibility to respect and honor the intimate relationship that Indigenous peoples have to this land. I also wanted to acknowledge that as we're coming up to the National Day for Truth and Reconciliation, just a few days away, this Saturday, in my own case, I will be thinking about the survivors of residential schools, their families and communities, and of course, in particular, the children who never returned from these schools. So maybe we'll just pause for a moment of reflection before we start. Okay, moving into the content for the webinar today, as any of you who are joining will very much understand and appreciate the very central role that patients, families, and caregivers and their communities play in the work of OHTs. Obviously, patient family caregiver partnership and community engagement is a key OHT element. It is part of building block 3 or central to building block 3. As well, an additional emphasis or focus has been given to PFC partners and ensuring their role at the governance table within OHTs as part of the Path Forward initiative this past year. One of the things that we've observed, and certainly it won't be new to many of you, I don't think, is that many people are doing this work, this really important work, with great commitment, but sometimes with limited expertise and capacity, both on the leadership side and in supporting this work to make sure it is done most effectively, most ethically, sensitively, authentically. And in particular, I think one of the things as a support partner we've noticed in our work with OHTs is that a considerable burden is being placed on patient family caregiver partners themselves to lead and support this work. And while they are obviously central to the mission of OHTs in the integration, the coordination, the delivery of seamless care that is patient-centered, I don't think any of us would expect them to take the leadership role in kind of making this happen, right? They need the help, support, and leadership of others within OHTs. So the impetus for this work is very much comes from an identified need to support OHTs to really demonstrate that centrality of partnership and engagement to all of the work that they do, and to put the key capabilities in place to make sure that this work is done in an effective way as OHTs develop and mature. So that's where this work, the impetus for this work comes from. In terms of the scope, the idea of engagement-capable environments, the idea of capability frameworks isn't a new one, and not even in the health sector. But the idea of thinking about it in a deliberate way, in a very specific way, in the context of OHTs is something that hasn't been given a lot of attention to. So the scope of our work was to really think about how we bring that engagement-capable environment perspective or lens to OHTs. So how do we think about what key competencies and supports and enablers are needed to do this work and needed to support OHTs at various stages of development and maturity? And then what are the training and related resources that are needed, right, to build and develop these competencies and enablers, and maybe where are the gaps, right? If we're concerned that we don't have all of the resources, the supports in place to do this work. So with that, I was really privileged and had the pleasure of co-chairing this working group, which led this work and set of activities, co-chairing with Betty Lou Christie, chair of the Minister's Patient Family Advisory Council, who many of you will know and have heard of, and know how much she is incredibly committed to the work and to the role of patient family caregiver partners in OHT activities. Was also really supported by a stellar working group consisting of OHT representatives from across the OH regions. We also were very mindful of making sure we had people in different roles in OHT so they could bring the perspective of the executive leadership role, the engagement specialist or engagement staff role, and of course the patient family caregiver role to this work. We also had some non-OHT representatives, namely from the ministry, from the Patient Engagement Secretariat and OHT Implementation Support Program, and also a key non-OHT patient partner who I've worked with quite extensively in many of my previous activities, Maureen Smith, who has had leadership roles in a lot of really significant research teams and in health system organizations of the various sorts. So really a terrific group, and I wanted to commend them on the work, and you'll hear from three of those members a little bit later in the presentation. So in brief, our collaborative approach was, we talk about a kind of a modified or adapted concept mapping methodology. I'm not going to go into the details of that, but just to say, we obviously always look to evidence to support our work, to identify existing or relevant frameworks, and we certainly found some of those, but again, not so much in the context of OHTs and how do we really map this through, across OHTs and thinking about their particular mission and activities. So with that evidence, we went out to the OHTs directly to have them brainstorm what are the skills, knowledge, attitude, behavioral competencies, and key structures and enablers that they feel are really important to support this work. And yielded hundreds of kind of statements. These are called brainstorming statements that came in and went through a process of distilling, sorting through, synthesizing to generate our draft competency and supports and enabler framework. We then went out to do additional consultation work with groups that could bring a particular equity and population focus lens to this work, obviously always guided by our working group. So met with our working group multiple stages every month for 3 or 4 months to make sure this work was moving in the right direction. Further refine the framework and consider this idea of stages of development or maturity to think about how we make this as accessible and tangible and easy to use as possible, so that we think about helping OHTs to consider this framework no matter where they are in their stage of development and maturity. And then importantly, to identify the key resources that would be needed, right, to action elements of the framework. And so with that overall approach, I'm going to now dive into the content of the framework itself. And I would encourage those of you who are interested to actually have a look at the PDF, the full document that actually walks through the details of this. There's a good amount of content to it. We're going to take a bit of a high-level approach to this in the interest of time, but would encourage you to really take some time to have a look at the full document. I believe it'll be in the chat if it's not already. So 2 key elements to the framework, one being that important sort of framework of competencies, supports, and enablers, and then the resources that kind of map from those. So on the left, looking at 2 sort of concentric circles or wheels. We can have different ways of thinking about what this visual represents to us, but the inner circle or wheel representing the actual competency domains themselves, and there are 6 of them. These are the individual competencies that we would be looking at building within OHTs. And then on the outer ring or circle, the organizational supports and enablers, and there are 4 of them. So all, told six competency domains and 4 support and enabler domains. And then we were looking, as I said a moment ago, at mapping this onto different developmental or maturity stages of OHTs. And the 3 that we looked at were the idea of building the foundation, learning and developing, and sustaining and evolving. So now I'm going to go into the kind of the detail of the competency and enabler framework in particular. And so again, looking at these 2 concentric circles or wheels, I'm now going to kind of walk through 2 per slide. So 2 competency domains per slide, starting kind of and moving clockwise from the top of the circle or wheel. And so these first 2 really capture what are the kind of foundational knowledge and kind of attitudinal competencies. So, perhaps not a big surprise that, if you're going to come into this work, you need to understand what OHT roles and functions are. But it's a little more, than that. We often have found that members of teams, OHTs, new members, in particular patient family caregiver partners, often struggle a little bit with the kind of the understanding where they fit, where OHTs fit in the bigger system, in the process of system transformation. What are the structural and funding arrangements for OHTs? There's a lot of complexity to this. I think nobody would be surprised to hear that. And so important thinking about, how do we ensure that people have a good basic knowledge foundation for doing their work, no matter what their role is with respect to partnership and engagement. And then equally important is this idea of recognizing the value of this to the OHT enterprise, right? To the centrality of engagement and partnership to the mission of OHTs. And that looks like variety of things that we might consider, the openness and sensitivity to the experiences of patient, family, caregivers. So we're going to, put patients, family members, caregivers at the center of everything we do in OHTs. Obviously, they need to be there. They need to be invited, respected, be sensitive to their perspectives, their experiences, their everything that they bring to their roles within OHTs. And so moving from this first pair of domains to the second pair, so we're now moving again towards the bottom of the wheel, the inner wheel, looking at the kind of what I call the workhorse of this engagement and partnership practice. So this is really where we're getting at, how do we do this work, right? We acknowledge the importance. We want to make sure people understand, why we're doing this, but how do we do it? This is where all of the kind of effective practices piece come in. Understanding what partnership and engagement means, what are the different forms it takes, what is the difference between something like co-design versus a consultation versus, partnering through a PFAC. All of these things mean different things, and sometimes there's confusion. And so really being clear about what are we doing, why are we doing it, what are our principles and approaches for this, and how do we support our learning and improvement in the space through evaluation. And then our working group felt very strongly that there needs to be a particular competency around integrating equity, diversity, and inclusion principles into all of this work, right? So while I think of it as part of the work of doing effective, authentic, ethical engagement, bringing EDI into this, it is important to think about it on its own because of the unique attention that needs to be paid to this. And so again, understanding the key concepts, what does equity mean, diversity, inclusion, how do they relate to each other? How do we think about applying these principles in different contexts, different OHTs, different populations and communities? And what are some of these terms, cultural sensitivity, cultural safety, Indigenous cultural safety, reconciliation, and accessibility requirements? And how do we break down the barriers, hopefully eliminate them if we can, but at least minimize them as much as possible. And then finally, the third pairing of competencies is all around more attitudinal and skill-based competencies around personal characteristics and communication skills. I guess I could not emphasize this more often. We often talk in organizational culture, speak about the soft skills. I think these are the hard skills. Maybe they're soft, but they're really hard in terms of the importance of them, the centrality of them. Honestly, everything I've seen and done in this space over 20 plus years suggests that this is where things go off the rails and can go awry and can really sort of erode trust between patient, family, caregiver partners, community members, and members of health system organizations. So I think really being thoughtful about building up those competencies. We can all think that maybe we know how to communicate, but do we really know how to communicate in the particular ways that we need to in this particular line of work? And so now I'll move to the outer circle, the enablers and supports. So all of what I've just spoken about we tend to think about this at the individual level, but our working group felt very strongly, and even in the survey brainstorming work we did, it isn't just about individuals building competencies. It's also about the organizations putting those supports and enablers in place to allow the competencies to develop, right, and flourish. And so we have 4 of them. First on this slide, the policies and strategies, and then structures and processes. And again, here, this probably won't come as a surprise. You're all thinking about this and doing hard work in this space, but it's being clear, right? Being clear in your strategy documents, your policies. What is that commitment to engagement? What does it look like? What are the foundational elements, and how do we communicate our strategies? But really, this is where the rubber hits the road. And it's fine to say we commit to this, we're aspirational, we want to do this, it's important, but you also need to put all of those procedures in place to make it work, right? So clear goals, operational plans, do we actually have can I go somewhere in the organization and find out what it means to actually do this engagement and partnership work? What are our procedures, and are they transparently communicated? And then lastly, the 2 other supports and enablers have to do with, the important capacity that needs to reside in OHTs to do this. This is hard work. We know that, we hear that a lot. It takes time, it takes energy, it takes resources. And so building that capacity from the OHT leadership on down or across, dedicated staff members whose responsibility it is to actually do this work, and therefore need the training and appropriate supports to do that work, not on the side of their desk with 3 other roles, but this is actually what I'm responsible for doing in my role, and I need to actually have the appropriate training to do it, as well as thinking about engagement budgets and compensation guidelines, and again, building that measurement and evaluation capacity in as well to support learning and improvement. And all that needs to happen within a learning culture, right? A learning environment, right? Where individuals are given the opportunity to learn from each other across OHTs. Support is adequate, and tangible support is provided for this through funding and other mechanisms. And it may be tailored for particular groups, or depending on the nature of the OHT or the particular individuals involved. So I'm going to move on there to very quickly give you an example of how the resources piece fits in, because many of you are thinking, oh my goodness, this is a lot, and how do I do this, and where do I go to build those capacities and competencies? And so for each of the competency domains, and we've given you one example here of the one for integrating equity, diversity, and inclusion principles. You would see in the document, if you're looking at it, a list of resources that's actually directly linked to each competency domain and each support and enabler domain. And then we've taken you through an example of pulling one out. In this case, it's the Supporting Equity-Centered Engagement Guide, where you would actually go to figure out, what does it mean to do this work? How do I understand the principles? How do I actually build my competency? So just thought that might be a helpful example of how you action this work. Moving to the second element, which is the mapping of the competencies and enablers to those developmental stages or maturity levels. Again, as I said, very important to think about where are we at currently in our OHT, maybe do some self-assessment around this, and how do we think about building and growing and developing in the areas that we've identified as priorities. So I've mentioned the 3 stages or levels already: building the foundation, learning and developing, sustaining, and evolving. It is possible that you could imagine maybe micro stages or levels within each, right? These are big and broad, and there's a lot going on in each of these. But it's just, I think you understand that the point of this is to be really thinking about how do we move forward? How do we grow and build and develop? And so I've highlighted in this slide and the next one, just a couple of examples to take you through what this looks like. So for fostering a patient-centered culture, if we're looking at that as one of our competency areas, we might early on be thinking just about how do we recognize that the quintuple aim, for example, can't actually be achieved, right, without the involvement, without the central role for patients, family members, and caregivers at all levels of our work, and started to think about how do we build that culture, right, that supports openness, adaptability, curiosity. As you move along the stages of development or maturity path or levels, we might just start to think about how do we put those practices, in place so that they're integrated across all of our planning and operations to foster that culture. And then ultimately, the goal is you never have to want to think about this, right? Because it's sort of there, it's everywhere, it's part of your philosophy, part of your DNA. And you've got a culture of accountability, there are clear expectations, and it's sort of everywhere. And the philosophy is that partnership is an engagement essential to everything you do is embedded in all aspects of the organization. And if we just take one more example here, a little bit more maybe kind of fine-grained around funding for patient, family, caregiver engagement activities. We often hear about this as a challenging area. So thinking early on about what funding and budget is required to do this work, to support our PFC partners in this work, and what are some guidance, what is guidance and kind of policies around compensation that we want to put in place. You then, as you move along and through your development, have those things in place, but you're continuously reviewing. People know where to find them. New staff come on and are immediately oriented to this. And ultimately, this is all ideally very seamless and continuously reviewed and revised as needed. And so that's the sort of the framework in brief. As you'll see, if you're looking at this in more detail, there's a lot more to it in the full document. We also wanted to not leave you with, here's a framework, go off and figure out how to use it, but to actually come up with some action plan steps for you around implementation. And actually, we're interested in hearing from you about how else you think we could action this, or how you think you might be looking to action this within your OHT, and how we can further support you with this implementation work. So we've laid out 4 steps, fairly clear and intuitive, right? The buy-in is crucial. We encourage executive leads and OHT leadership to identify this work as a priority, a high priority, and adopt it for your OHT. It's as simple as that. If you make this so as a priority and you adopt it, people have to pay attention to it. We think as part of that, identifying your framework implementation team is important. So who's going to own this? Who's going to manage this? Who's going to make sure that you're paying attention and walking this through? We encourage that to be a multidisciplinary team. That should include leadership, staff, and patient, family, caregiver partners, to ensure that there's a variety of perspectives brought to this. Self-assessment, I've mentioned already, is an important piece to this, right? Reviewing and discussing, the competency supports enablers. Go through those 2 wheels, the inner and the outer. Where are you at? Current state. Where can you identify and agree on your areas of strength and maybe your areas for growth and development, right? So where are you on also the developmental scale or stages of maturity? And then, importantly, as part of this, making sure you identify who else to share this framework with, right? We have actually been hearing that new onboarding of new engagement staff or patient, family, caregiver partners can be a fantastic opportunity to share this framework so that they can also start to begin that self-assessment process. Obviously, step 3 is the really important piece around prioritizing and actioning areas of focus, right? What are your short and longer term priorities? This is not something you're going to be able to do overnight or over a week or over a month, but start to put your plans in place for how you're going to build and develop your competencies and supports. And, thinking about the reviewing of resources, what training opportunities have your staff, your patient, family, and caregiver partners been able to take advantage of? What are some things coming that may be worthwhile for your OHT members to be thinking about? All this important priority setting and actioning work. And then obviously evaluation is important to all of this, is to maybe identifying some simple metrics for monitoring, right? you shouldn't create something that's so overbearing that it's not easy to act and move. Simple steps, and you may hear from some of the OHT co-presenters on some very practical tips for this. But thinking about the monitoring, right? Thinking about, again, how do we continuously orient and train our new staff, our patient, family caregiver partners to use this framework. So I'm now going to move on to our next piece of our webinar, which is hearing from the OHTs themselves. Really thrilled that we have Lindsay, Latcha, and Reham to help take this to a little more of a practical local level, right? To have you reflect on how you're thinking about this in the context of your OHT. So I'm going to stop sharing right now so we can hear from our panelists. So Lindsay, over to you when you're ready.
Thank you, and hello everyone. It's a far better photo of me than I normally look, so I apologize for that. But just wanting to share a little bit about our approach and our journey in Mississauga and sort of how we intend to use this framework going forward. So I think what we approach this at the Mississauga OHT as a really fundamental paradigm shift. I think a lot of times the conversation is, when do we engage patients, families, and caregivers? When should we bring them? What type of things should we bring for consultation? And we really chose to have a different approach, which is all the time. They're part of our core team, so embedded within our core decision-making team, and really took the statement, nothing about us without us, seriously. I think we have a healthcare system that is often built around providers and programs, and really taking the opportunity with our OHT to think about how do we really anchor this in the people who are receiving the services, which includes you and I and everyone on this call are recipients of these services as well. So we sort of took an approach that looked at our structure, at how we're enabling it, and how we're embedding it. So within our structure, we spent time to establish an advisory, which is directly connected to our Collaboration Council, which is our decision-making body for our Ontario Health Team. And that we established a PFAC effectively, so what we call it the Community Health Advisory Network, which was done in consultation with our patients, families, and caregivers. From that, we designated co-chairs, worked with that group to identify a work plan, identify co-chairs, identify processes, co-design policies, and assured a seat, or 2 seats actually, for our co-chairs on our Collaboration Council. So they're part of the decision-making process and direction giving for our Ontario Health Team. In order to enable the work, we recognize that there needs to be flexibility and recognition of the contribution that people are making. And so we've implemented a full remuneration policy for our patients, families, and caregivers, and we support that if there's OHT leads on this call, through our implementation funding. So we made that a priority with our implementation funding, and we provide that support in that way, understanding the degree and level of engagement we've asked of our patients, families, and caregivers, and I think more importantly, the level of dedication that they have shown us. So we've done that. And in terms of how we've embedded the work, as I mentioned, our patients, families, and caregivers are involved at all levels of planning and steering and governance from beginning to end. I mean, there is no beginning or end, it would seem, but they sit at all of the tables, all of the planning conversations, and participate as any other provider or partner would. We provided supports and continue to work with our PFAC to identify what supports would help facilitate meaningful participation and engagement. That was a big thing we heard from our patients, families, and caregivers as well, is how can we support them to participate at tables with, as we all know, lots of jargon, lots of coming in kind of mid-sentence to the kind of broader conversation. So really doing that. And then we felt it was important, we need to be able to coach our co-chairs and our members who are working to be able to work effectively and meaningfully with our patients, families, and caregivers. So these were pieces of work that we did put in place. And I think our next steps are really about using this fantastic tool. And I give credit, obviously, to Julia and the entire team who put this together. It's truly fantastic. And I and embedded within our broader OHT maturity model as an expectation, but we will complete a formal assessment, and what we're doing is embedding it within our annual strategic planning process, that we will do a self-assessment of this. going forward, and we can address gaps that we have and align any of our planning to it. I know right off the bat, one thing where we fall short, admittedly, is we do not have a dedicated, solely focused individual doing patient, family, and caregiver engagement. We do have a very skilled staff who supports the work, but is also supporting other priorities. So we know that this is an area that we need to improve. And we've also embedded this within our multi-step maturity map that we've seen for our Ontario Health team. So those are some of the ways that we're putting this in practice, and look forward to learning from our colleagues and other OHTs and our PFAC about how we can continue to improve on that. Thank you.
Great. Thanks very much, Lindsay. Really appreciate the very practical way you've walked through how you're thinking about this, and even, being honest and identifying shortcomings. This is tough work, and so it's great to hear the practical ways you're thinking about this. So I think we're going to go to Latha next, our patient family caregiver partner from Nipissing Wellness. And if you want to provide any more information about your specific role at the OHT, please go ahead, Latha.
Well, thanks so much, Julia. I just want to build on what Lindsay was saying. So a lot of what they have in place with their OHT, we have as well. And I jumped into this work wanting to tell my mom's health journey and to share the positives that happened along the way, so there would be a ripple effect. And that's how I began. And then I was a member, and it was recognized the experience and skill set that I was coming with. And then I was asked to be a co-chair. And then not long after that, our OHT chose to include a tri-chair at our collaboration council level. We call it collaboration council. Other OHTs have a different name for their steering committee. And I really appreciate that opportunity. And I'm just in the process of, actually, I will be moving away at the end of October, and I'm sort of bringing someone else on board, helping to make sure that we don't have any gaps, that we don't have any, that we continually help support each other. The other thing that I think is really important is to ensure that you're a voice and you bring perspective wherever you can in conversations about making sure that there are supports with the staff, like Lindsay was saying, that there's someone dedicated to this work, because there are patients, families, caregivers that are coming in and out, and they are in a health journey themselves. So there's a continual renewal of people. So it's really important to have some continuity and structure in there. Some of the other reflections that I wanted to add too was, I just wanted to say that this very process of being involved in this way at the provincial level, and I encourage other people to jump in where they can to be a part of developing resources like this and initiatives and projects, is that Dr. Abelson alongside Laura Tripp have led this very process in the way that we want to work and move forward together with patients, family, caregiver partners right alongside. They've done that so well, and I feel very heard, and as do, I think they continue to go out to seek perspective. And I think that's what we want to do locally too, is always thinking, okay, whose voices are not at the table? Let's reach out. So it's a continual, and that listening stance is so important. I wanted to add also that this is an iterative process. And I think Dr. Abelson spoke to that as well, that it's a continual refinement. So if you're thinking, "Ooh, we need more information here, where do you go? What kind of supports do you reach out for?" And this, the framework that's been developed is perfect for that, because it actually gives everybody a common language. So we can all lean in together, all the partners, staff, health partners, patient, family, caregiver partners, speaking the same language, using the resource. I actually see it being used also with the highlighters, and just sort of highlighting where are we now, and then going back and saying, where can we go next? What are our areas for growth? And I just wanted to say there was such great intention. It was such a rich conversation, and there was such trust that it was okay to bring forward some of the things we were concerned about, and that was heard, and I appreciate that. So an example of that is making sure that the resources were hyperlinked. So to make it really easy to access, there's a lot being developed out there, and it can feel overwhelming. So we've sort of pulled it together so you can seek out what you need when you're ready to, because everyone is on their own path, every OHT. And I think Lindsay alluded to it too. I think the important thing is to realize that we're here together. There's a community of practice to jump into too, where ask those questions. Don't be afraid to ask them. It helps all of us to move forward together. And I think just in the end, I want to say again, thank you so much for this opportunity to be a part of developing it as well. And it's been an incredible experience. Thank you.
Thanks very much, Latcha. I think I tried several times to encourage you not to use the doctor when you're talking about me, but that's so I didn't succeed entirely in leveling the playing field.
But that's well earned too.
Oh, okay.
And you're right, Julia. Thank you.
Well, yeah. So on that note, we do have another doctor on the panel. So I will introduce Reham. Reham is from the Burlington OHT. And you know what, Reham, I'm going to let you introduce yourself because I think you actually hold a very unique role in that you have expertise in engagement, but also in evaluation and a lot of other things. So I'm just going to let you share what you want about yourself and your role, and then whatever reflections you want to contribute.
Thank you so much, Julia. So my name is Reham, and I'm the Population Health Management and Evaluation Lead for Burlington Ontario Health Team. However, for the last probably 15, 17 years of my life, I've been always a researcher. And actually, my PhD is in evaluation of complex interventions. So that's giving me like special mindset when I'm looking at engagement. However, a very big piece of my thesis was actually looking at evaluation from a patient perspective. And that's how I got in love with engagement work. So back to the framework, I think it's very important whenever we're thinking about engagement to have this complexity in our mind. Engagement is a lovely thing to have, but it's very hard to implement and plan. And that's why having a framework that is kind of connecting the best of both worlds, research plus people who are actually doing the work, and making it, yes, evidence-based, yes, strong, but yet easy to be implemented. That's a very strength, I believe, a very important strength in the framework. The second thing is that in order to be able to use this framework, from my understanding, is that you want to be able to think about it from like a day-to-day perspective. How can I use this? Back to the complex intervention piece, you can use it to plan your intervention. So if you're a new OHT who's thinking about how to plan your PFAC, who to invite, how to bring leadership together, how to put a common vision, how to find out structures and resources that can support you, how to implement policies, or maybe find policies across your partners that you can just learn from and implement. And then when you're implementing, having a framework when you're implementing is very, very, very good thing to have. It's very structured. You can see like where to start and where are you expected to end. And with that, all the outcomes that are already in the framework are going to help you to understand where are you in the process of implementation, but also what expected outcomes you should be looking at this particular time. Because most of the time we don't do like fairness enough to our interventions because they are complex. They take lots of time, and you can't expect that the outcomes, the long-term outcomes, would happen like after the first year. But understanding that that's an iterative process, that's a building that we are building steps and steps and steps over time, is very important. I would just say something about the evaluation piece. So when I joined the Burlington OHT, they already had a very strong PFAC. Actually, they had PFAC very early on that they helped in the writing of the application of the Burlington OHT. So basically before having the Burlington OHT as an entity. Also, the leadership was a very critical key in having this happening very early on in a consistent way. Also having policies and procedures in place to support this, whether a remuneration process, whether a recruitment process. However, I thought that because it's a complex intervention, because I'm an evaluator, let's do an evaluation. So I did a comprehensive evaluation after I joined the Burlington OHT, and at that time, this framework didn't exist. However, Julia's work before then helped me a lot. All the tools that she created earlier, I used it. I used like multiple combinations of it. And out of this evaluation, we were able to highlight areas that might need some improvement, including not having a dedicated staff, for example. However, now we do have a dedicated staff. I think she's also on the call, Jane Johnston. Before then, we didn't. So stuff were happening in a good way, but not in a perfect way. And also consistency was very hard. The other thing is that we had a very strong PFAC, but it wasn't representative of all the people that we want to serve. So after that, we had a different policy of recruitment, also a different approach on the reach out, how to reach out to people who are not kind of normally or frequently represented. Now I can say that we have a perfectly representing PFAC to our community. Before then we didn't, but we didn't know that unless we ask people what is missing. The other piece that also we didn't know that onboarding needs to be like a structured process. Now we have like a structured onboarding process. We even have a peer support process within our onboarding. So with couple like an old PFAC member with a new PFAC member, maybe they're interested in the same area and they can work together. All these learnings only happened because we started asking ourselves questions. How are we doing? How can we improve? It doesn't have to be super hard. It doesn't have to be super structured, but it has to happen. Whenever you're implementing something, don't ask yourself like, I implemented this good. You need to ask yourself, how can I make it even better? Thank you.
Terrific. Thanks very much. And so you can hear from Lindsay, from Latha, from Reham, very different roles in their respective OHTs and different approaches to thinking about this and the action piece that we're so keen to see happen as a next step. I think, as Reham said, the importance of a framework. Frameworks often are considered very academic. We in academia love frameworks, but frameworks are there to be very practical, to be used, right, to be applied. So hopefully that is conveyed, that this isn't something to sit on a shelf, to sit somewhere on a in your inbox or whatever. It is actually to be used and to be useful. I also think, from hearing the various perspectives, this idea of kind of the science and the art of this, right? There is a science to this engagement work. And I think often people think it's just this nice thing, relationships, there's a lot of work, right? This idea of effective approaches, we have data, we have evidence about some approaches being more effective than others. How do we approach this in an evidence-informed way? I think that's really important to be thinking about this. But there is an art to this as well, right? And I think a lot of the comments about the iterative, the check-in, look at what you're doing, there is both the art and the science to this. So a few other reflections. I know that there's a little bit of Q&A happening, which is great. And I think we have a chance to pause here and see if people have questions, specifically maybe about the framework or about the perspectives that our OHT co-presenters have brought to this. I have one other slide about kind of some next steps, but I'll hold off and see if there's anything that people want to ask about or share from their perspectives. Okay, so question from Nadia. Our lived experience partners have asked for some general healthcare system education. Does anyone have a good resource they can share? Resource linked, well, useful to understand how to access care. They're looking for more information about structures, pieces of the system, etc. Is this a better question for the COP? So I don't know if any of our OHT members want to comment on this. I have some thoughts and we can follow up with you separately, Nadia. Any? Reham?
Maybe I just have a follow-up for Nadia before I answer. Is she looking at like accessing services or just to learn more about the healthcare system?
Sounds like general information about, the phrase is general healthcare system education.
It's just because I know that multiple OHTs are working within their websites or even having some apps that is public facing, and they are created for this particular reason, to understand what is the healthcare system that you're living in, like the local one, what are the services there, how to access these services. So there are multiple examples there. They are locally based, so based on the community that you're living in, but maybe that's a starting point that you can access and then go from there. Also, there are some provincial assets on how to access healthcare within your community.
Yeah, if I'm understanding the questions, I think about about understanding how the healthcare system works, right? The structures, and that I mean, certainly there, the RISE group and McMaster Health Forum has, I mean, a book on the Ontario health system. I know that anything about, you know, system structures gets out of date quickly because things change, right? New governments come in, things. So that predated OHTs, but I think the idea of providing some general information about how the Ontario health system works and could certainly be a very useful resource. I don't know that we have it in the resources that are linked to the first competency around understanding OHTs and structures, but we can certainly look at that to see if there's something specific that would be helpful on that. So thanks for that question, Nadia. Okay, if I'm missing any questions that are coming, please let me know. I think I'm going to share my screen again and to move to our last slide. And we also have a short survey for you to complete at the end to help us with our next steps. So just to give you a sense of what we're thinking about with respect to implementation support work for this framework, we are actually meeting, working with the advance coaching team and actually involved in a session with them, which is focused on patients, families, caregivers representation and collaborative governance. That's happening in late October. So we'll have a chance to work directly with the advanced coaching team there. Our working group members, I hope this is still the case, have mentioned this to us many times, that they like to see themselves as champions for this work. I mean, that's partly why they're here today presenting with me. But I think you could certainly reach out to any of them as champions for this work and to help think through things that you're working on. Our team, the PPEC team, is certainly available for some limited consultation and targeted coaching work. I mean, the challenge is just around our capacity to do that across the board. We're thinking about that, and I think in part, depending on what we hear are the needs from OHTs around implementation, you'll be hearing more from us about that. And we're also thinking about future webinars, and we're interested in your thoughts about this, what we could focus on. So would it be useful, for example, to have a dedicated, set of webinars on particular competency domains, or, thinking about the development stages and maturity work? We're interested in what follow-up, more detailed, kind of deeper dive webinars, what would they look like? So if you have any thoughts about that to help inform our future planning around this, that would be great. Or in the evaluation survey, which you're going to receive at the end of this. So question from Karen: have you had any PFC members provide training within the respective OHTs since they have expertise outside of their health history / story? So I gather this is a question for any of our OHT panelists. Have you had any PFC members provide training within their respective OHTs? Okay, Latcha, go ahead.
I was just going to ask, maybe Karen can speak to this, because I'm not sure if she's referring to the use of the framework or just in general supporting the recruitment and of new members on PFC. I wondered if maybe she might want to add a little bit more in the chat, or if she wants to. I don't know if she's able to speak
in any way that might relate to their expertise as it relates to healthcare.
I'm not quite sure if I'm understanding correctly, but I feel like we come into this work as patients, families, and caregivers with our own journey, and you will have experienced some very positive just exchanges and scenarios and contexts, and you bring those forward, and also wherever you can in the working groups or any conversation that you have within your OHT to ask the questions and prompt conversation that helps your health partners and the transformation staff to see it from the patient family caregiver perspective. And as I was saying earlier, never to be afraid to ask for clarification or bring questions forward. That's how we grow that relationship of trust. And it just helps us to understand each other's roles in healthcare, including the patient family caregiver. I see Sandra's responded as well.
Yeah. And I wondered about
That's
that.
helpful.
So thanks for that suggestion, Sandra, and or example. I also hear about coaching, right, and mentoring of patient family caregiver partners of other patient family caregiver partners. So that perhaps is a little bit part of this as well. Reham, please go ahead.
Actually, in our PFAC, we do have kind of a similar approach. So during our monthly PFAC meetings, we have like a 30 minutes of open discussion where any of the PFAC members can bring a story, an experience, an article they read, maybe a not-for-profit that they are volunteer on, and bring these news to the whole PFAC, and that's including all the staff as well. So it's kind of a learning experience for all of us. We exchange knowledge. We're all partners and we're all equal. So that's one thing. And in terms of the professional backgrounds, because I think there is like a note about that. We recognize our patients and family caregivers, not just as caregivers and patients, but also as people. And because many of them has professional backgrounds that are pretty rich, they actually use this expertise in helping us in areas where we don't have actually staff that can support. Finance would be one, business function would be another. Communication used to be for a long time. So I think it's whole coming back to the vision. If the OHT is visioning their PFAC as equal partners, then this should be very easy. Thank you.
That's great. Thanks so much. I think we'll just move to, actually, I'll just pop up the last slide just so people have it. Certainly, if you want to reach out to us directly, our email address is here, ppec@mcmaster.ca. Obviously, the guidance, the framework itself is available on our OHT page on the PPEC website at McMaster. So all of that is there. So I just wanted to make sure that was included. We have recorded this webinar, so that will be available to all of you as well for follow-up and kind of taking the time maybe to look at this in a little more detail, recognizing it's a busy day for everyone, and another OHT announcement later this afternoon. So I think we can wrap up unless there's anything else that people want to contribute. I'm just looking at the Q&A and the chat. Yeah, no, I think that's it. So with that, I will give you all a little bit more time back and I want to thank our three OHT co-presenters very much, not only for today, but all of the terrific work, contributions throughout the working group process. It really was a pleasure to work with all of you, and we will have you back for other things as the implementation work continues with this. So thanks everyone for a great session, and enjoy the rest of your day.